demonstrate the emergency management of prolapse cord. Prolapse may occur at any time after the membrane's rupture if the fetal presenting part is not fitted firmly at the cervix. First, I will gather all the equipments needed on this procedure. Good afternoon, ma'am. I'm Nicole V. Cordero. I'm your student nurse for today. I will do the internal examination wherein I will assess the progress of your labor. Can you state your name, your age, and your birthday, please?
I'm Roslyn Tacadena, 29 years old, August 3, 1991.
Thank you, ma'am, for your cooperation. It is important to check the patient's identity to not cause harm to the patient. Ma'am, you will be positioned on the examination table to assess the progress of your labor. Is it okay with you?
Yes.
There are 3 positions that are employed in the internal examination. First, the dorsal recruitment. The second one is the Sims position. And the last one is the knee chest position. The given positions are made best so as the gynecologic area is being examined. Position depends on the client's capability or the examiner's preferred position. Ma'am, I will put the drape on you and expose the part that I really need to assess. Is it okay with you, ma'am?
Yes.
Always respect the client's modesty and provide the client's privacy. I will do the hand washing, ma'am. Then after that, I will put the examination gloves for internal examination. Then after a while, it will change into sterile gloves after to assess the progress of your labor. It is to protect the healthcare provider from contracting gynecological diseases caused by highly infective organisms. Ma'am, while I inserted my 2 fingers, kindly take a deep breath while I'll do the internal examination. Take a deep breath, ma'am. If I see cord protruding in the vagina, I will handle it carefully. On inspection, the cord may be visible at the vulva and to assess the cord pulsation. I will be now assessing the heart rate of your baby by putting on the stethoscope on your abdomen. To rule out cord prolapse, always assess the fetal heart sounds immediately after the rupture of the membrane, whether it is spontaneously or amniotomy. If you are in the CMOC facility, report the findings to the obstetrician for emergency cesarean section. If you are in the BMOC facility, the following procedures below are the emergency management for prolapse of the umbilical cord. Ma'am, I will assist you to knee chest position. Take a deep breath and do not bear down if you have the urge to do so. Knee chest position. Knee chest position uses gravity to shift the fetus out of the pelvis. Ma'am, I will be inserting the catheter that will inflate your bladder by a sterile fluid to help in reducing the compression of the prolapse cord. If the decision to deliver interval is likely to prolong, particularly if it involves ambulance transfer, elevation, true bladder filling may be more practical. Bladder filling can be achieved quickly by inserting the cat end of an intravenous giving set into full-lace catheter. The catheter should be clamped once at 500 to 750 ml have been instilled. It is essential to empty the bladder again just before any delivery attempt, be it vaginal or cesarean section. Let's assume that this is 500 to 750 ml. Ma'am, I will put my gloved hands into your vagina to push the head of the baby upward. And take a deep breath if you have the urge to bear down. Do not remove your fingers until you arrive at the operating room or by the instruction of the obstetrician. Elevation of the presenting part is thought to relieve pressure on the umbilical cord and prevent mechanical vascular conclusion. Manual elevation is performed by inserting a gloved hand or two fingers in the vagina and pushing the presenting part upwards. Excessive displacement may encourage more cord to prolapse. To prevent vasospasm, there should be minimal handling of loops of cord lying outside the vagina. Baby out, 5:45 p.m. If the baby is with good crying, I will proceed with EINC, and if it's not, I will cut the cord and resuscitate the infant. After the procedure, I will remove my gloved hands and wash my hands for infection control. Lastly, I will document the data, time, and the procedure to provide the accurate data in the care of the clients.